Good afternoon, Wolfpack fans. I love seeing all of these really enthusiastic hometown folks here, and I'll tell you, I appreciate you going along with my request that we all wear our pride. And I have to tell you too, I've never lived in a community in my life, and I lived in a real college. Not that this is a real college town, but I lived in a college town where the population was 12,000 when school was in session and 5,000 when we were gone. So that was a college town, right? We ruled that place. It was the first city council that was ever all Green Party. And this is back, I'm old, this was back in like 1996. And, but I've never seen a community come together like I have seen here in the commercials I'm watching on TV during the news and all the alums that are now professional players in sports. This is a special place, and I'm so proud to call this my chosen home. I've been here for 19 and a half years, so I guess this is home. And I appreciate all of you for your enthusiasm and indulging me in dressing a little down. Your district health officer said, well, I will wear a suit to show respect to the board. And I said, no, Mr. Dick, you must wear your sweatshirt. So I'm proud. He's not comfortable like this, but I love it. So thanks, guys, and go Pack. And I called that they'd make it to Sweet 16. I bet no money on it, of course. And I'm calling today. They're going to go all the way. Right, guys? Okay. All right. I'm not putting money on anything. I don't make enough to be a wagerer. All right. This is the Washoe County District Board of Health. Today is Thursday, March 22nd. It is 1:02 p.m., and we will be out of here before 4:07 p.m., I promise you. Today is item number 1, Madam Clerk, the roll call and determination of quorum.
Chair Joan.
Present.
Dr. Novak.
Present.
Oscar Delgado is absent. Dr. Hess.
Present.
Christopher Dare.
Here.
Michael Brown.
Here.
Tom Young is absent, and we have a quorum.
Thank you, Madam Chair. Now is time for the Pledge of Allegiance, and our recent transplant and huge Wolfpack supporter, Mr. Dean Dow, could you please lead us in that? Thank you.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And Dr. Hess, I am not dissing you or anything. You wore blue, and that is good enough for me. Thank you. Madam Clerk, do we have public comment?
Yes, there is one on the dais.
Okay, thank you very much. That is Mr. Joseph Williams, and he is from Sunshine Ice Cream. Come on up and speak. You get 3 minutes once you start.
First time for me here. Thank you very much. I have a small ice cream truck. I've been doing it for almost 25 years. Been with you for that time. And what I want to speak about it's that I don't work all year round. It's a seasonal thing. My truck sits in my house for 5 to 6 months doing nothing. All I sell is ice cream. It's all packaged. There's no food. I don't deal with food. Everything that I have is closed. And just the feeds have changed tremendously. From $103 all of a sudden was $4.85 now. And by the time it comes to mine is due on February the 28th, I renew my permit. And it's kind of hard to come up with that big old lump right now. There's no separations of payments or anything like that. You got to have it all at once. So I put it on my credit card because I don't have the money to pay it. So it's just a little rough to work with that. And I think that you have it in your books that is described as a food truck. They're not a food truck. It's an ice cream truck. And I think food trucks make more money than I do. The highest price that I have in my truck is $3, and I don't sell that all day long either. And that's pretty much what I wanted to say. And I wonder if you can consider something, maybe going a little lower on the fee.
Okay. Thank you, Mr. Williams. You don't have to stay for the rest of the meeting so that you can go back and figure out a way to pay your credit card bill. Let me just tell you this, we will bring this back to the district health officer. We will, the chair and the vice chair will have a discussion about this, that it might have been a oversight. We can't do any policy right now because we're not agendized for that, but I promise you, we will be getting back in touch with you.
Oh, I really-
And even if we can come up with a payment plan, you know, those sort of things, or to reclassify you, I promise you, we will work with you on that. I love the ice cream man.
Thank you so very much for your
Thank you,
time.
too.
Thank you.
Clearly, thank you. Any other public comment, Madam Clerk? Thank you so much. Item number 4, Board, is the approval of the agenda for today.
Make a motion to approve. Second.
I have a motion by Brown, second by Novak. Any further discussion? Public comment? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Any opposed? That motion carries unanimously. I have to mention, too, that former Councilwoman Jessica Sferrazza is here, and she is wearing a Wolfpack ball cap, which I think she looks gorgeous in. So thanks, Jess. Recognitions, our favorite part. Mr. District Health Officer, take it away.
Thank you, Madam Chair. First, we have promotions, and we have 2 environmental health specialist trainees that are advancing to environmental health specialists. Unfortunately, they're not able to be with us here today because they're doing some required training. They are working, and it's Matthew Christensen and Michael Towie, and so I just want to congratulate them. And this is one of that group that we're very proud of, that I told you about, that went and passed their REHS exam last July, and this promotion is based on both that and their the term of service that they've had in the EHS trainee position.
That's great.
And-
Congratulations, Mr. Christensen and Mr. Toohey.
And then next, we have somebody that I want to recognize as a shining star, and I want to explain that a little bit for the board. The county has established a employee recognition program called Shining Star, and employees can be nominated by either fellow employees or by our public for excellent customer service. And so we've had this going on for a few months now, and we've put little cards on our counters so that the public can leave comments and nominations and whatnot if they're here, and get that excellent customer service. And so I wanted to recognize today Carmen Mendoza. And Carmen, if you could stand up, and we'll get a picture in a few moments. But Carmen has now received 5 of those Shining Star nominations for recognition. And so with the program, once you have 3 of those, then the county manager signs a certificate, and you get recognized by the Board of County Commissioners. But I wanted to make sure that our Board of Health had an opportunity to recognize Carmen. Carmen came from the WIC program to our Vital Records program, and has been very successful there, has advanced to lead that program office. And I would mention that the 2 other people that are on her team both have received 2 Shining Star recognitions so far. But it's, I think, a real turnaround that Carmen's achieved. That's a counter where oftentimes we do have people that aren't getting what they want because of the law. And so to get that number of excellent customer services in a difficult environment like that, very proud of Carmen. So I wanted to have you recognize her.
Carmen, that is amazing. And Ms. Mendoza, we will take a picture in a second after we have our words, but I want to let you know that one of the biggest complaints I used to get, I've been on this board for about 8.5 years, and one of the number 1 calls I would get is I can't get a death certificate, I can't, what was the birth certificate? I mean, things that are very vital to people, and a lot of times in a really stressful time of their life, and being told, go here, go there, oh, we can't do it, this is a difficulty. I can tell you, since you've come on board, I've received 0 phone calls and 0 emails. So I thank you for that. When it gets to the chair of the board, there's usually a problem going on. So I thank you for figuring out the process, and of course within the legalities of it, and for taking on an area that was difficult. It's the best way I can say it as an ambassador. But we will be getting a photo. Would anybody else like to say something to Miss Mendoza, our shining star?
I'm glad our shining star is from here.
Me too. All right, you guys want to go down and take a photograph?
So we have a proclamation. You want to do the
Oh, yeah,
proclamation
hang on
and
a
then
second, Miss Mendoza. We're going to do a proclamation because we do a photo with that as well. We like to do all of our photos at once so we can stay back here then after that. Thank you. Go ahead, Mr.
Okay,
District
shall
Health
I go out
Officer.
in front to
Sure.
do this? I think you've got the
And you've got
official
the-
one in there. Yep.
Thank you.
Is this on? I guess it is. So today's proclamation is for Stop the Bleed Day, and I think that we have Mrs. Christina Conti and Stephen Shipman. So the National Stop the Bleed Day proclamation. Whereas uncontrolled bleeding injuries can result from natural disasters, man-made incidents, or everyday accidents, and whereas if the bleeding is severe, it can kill an individual within minutes, potentially before trained responders can arrive. And whereas, no matter how rapid the arrival of professional emergency responders, bystanders will likely be first on scene. And whereas, research has shown that bystanders with little or no medical training can become heroic lifesavers. Similar to the use of CPR or automatic defibrillators, improving public awareness about how to stop severe bleeding and expanding personal and public access to bleeding control kits can be the difference between life and death for an injured person. And whereas Stop the Bleed is intended to cultivate grassroots efforts that encourage bystanders to become trained, equipped, and empowered to help in a bleeding emergency before professional help arrives. And whereas Washoe County intends to build resilience by empowering the general public to be aware of the steps that can be taken to stop or slow life-threatening bleeding and to promote the general public's access to bleeding control kits. And whereas it is appropriate to recognize the value of bystander responses by designating a National Stop the Bleed Day, so therefore be it resolved that the Washoe County District Board of Health does hereby proclaim March 31st, 2018 as National Stop the Bleed Day in Washoe County, Nevada. I have a certificate.
Great. Ms.
provide.
Conti, would you like to say a few words?
Thank you. Thank you very much for acknowledging that March 31st is going to be National Stop the Bleed Day. Obviously, it's a national movement, and we're proud of being a part of that here in Washoe County. Our Washoe County trainers at this moment is REMSA, and they have begun doing trainers here at the County Health District and in the community. We also wanted to make sure that you knew that the penalty dollars for this coming fiscal year will actually be used to pay for future classes for county employees. And then Stephen Shipman has been instrumental in helping get the bleeding control kits throughout the county complex. And obviously we need to do more, but we've begun it and we're real proud and we appreciate these efforts and the proclamation.
Thank you, Ms. Conti. And I strongly encourage this board to go through that training. I have yet to do it myself, but as the proclamation read, one of the most important things you can do in an active shooter situation with massive fatalities or injuries, if you can, is to stop the bleeding so that when the first responders get there, at least it's not a life-threatening crisis in as much as you can possibly do that. So I encourage this whole board as health district board members to know that, to have, well, Dr. Hess, you don't need to do it, but so that you either, Dr. Novak, but for the rest of us lay people, I think it's a very powerful tool to have anywhere you go in the world. So thank you, Ms. Conti.
Our pleasure.
Photo time, guys.
Shall we start with you when we're up there?
I'm trying. Okay, on three. 1, 2, 3. And one more. 1, 2, 3. Thank you.
This is a bon voyage for everybody else who's headed to Rome.
One, two, three. And one more. 1, 2, 3. Great, thank you.
Safe travels, and thank you for all you do. Ciao. Ciao, bella.
Christmas time this year.
My wife said, my wife doesn't know what that.
And Miss Mendoza is leaving for 2 weeks for spring break to go to Rome. So, like we said down there, ciao bella. Yeah. All right, that takes us to consent items. I want to just say one other thing, if I may, about the National Stop the Bleed Day. I think it is a great policy that we are using the REMSA penalty fund, which we collect money, to use in a way that helps employee development here in such an important area in the times that we live in. And so I want to thank you, REMSA, for that, for providing that and providing the training and everything we need. So thank you. Okay, item 7, consent items. Does anybody have anything they would like to pull out of consent?
No.
If, okay. Do you, I will accept a motion. Yeah,
Yeah. I move that we accept the agenda.
I'll second that.
the consent items?
Yes.
Okay, great. And I just want to point out, I don't need to pull it, but we are reimbursing for expenses Miss Julie Hunter, who's a senior air quality specialist, and she will be going to the Wildland Fire Air Quality Response Program. So when there are any wildland fires in our region, she will be there on the ground, learning about how it affects air quality and also advising them about their air quality. So this is a regional expert that's going to take her expertise out of our region, which then in turn affects our region, right, Miss Albee? Yes, ma'am. Thank you. So congratulations. Item number 8, presentation from REMSA board member representing the accounting profession, and that is Mr. Nelson, our appointee. Oh, sorry, we didn't vote. Thank you, Madam District Attorney. All those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. And Mr. Nelson.
Madam Chairman, I appreciate the fervor that you wanted to get me in front of you.
Yeah, you look great. I love your outfit.
Well, as a third-generation Nevadan and Nevada alum, I couldn't pass up the opportunity to show our colors today, and I appreciate your confidence that we're going to win
All
at
the way.
407 today. Madam Chairman and the board, just for the record, I, again, am Tim Nelson, which is the CPA, or the accounting appointee of the board to the REMSA Board of Directors. It is surprising to me that I've been in this position for a little over 3 years now. And so in January 2015, you all appointed me to the REMSA board, and our financials were a little bit in a different position 3 years ago than they are today, which I'm very proud to say. We submitted our annual audited financial statements to you guys about 2 months ago. I'll go over the highlights so that you kind of have it in front of you. For the year ended June 30th of 2017, we had revenue of just over $50 million, net of about $200,000. The salient points here, we continued our debt reduction over the last fiscal year of $1.9 million. Including, or not including, a $2.1 million increase in our capital expenditures for the years. That means during my tenure on the REMSA board that we paid down about $4.5 million worth of debt. And as of June 30th, our debt to assets ratio is now about 30%. So significantly more healthy than we were 3 years ago. That being said, we continue to find ways to make our operation more efficient, more profitable, sometimes to Mr. Dow's chagrin, and improve our aging infrastructure, including the replacement of all of our monitors we just got to do here recently to the tune of $1.2 million. So we continue to do that, and I can't be more pleased with the board's progress and the board's information, as well as the clarity that we continue to strive both to you guys and the other community partners in the area. So while that's the high points, I'm happy to address any of the questions that you might have about REMS's financial statements, either last June 30th or continuing on right now.
Great, thank you, Mr. Accountant Nelson. I'll start down here to my right. Any questions?
No,
Any comments?
it's good.
Okay, well, great job. Thank you for doing why we appointed you. What do you attribute the change in the paying down debt and your debt to assets ratios? What is it? Just a different direction of the board? Is it
I could say that it's the hiring of Dean a little while ago. Really what it is focus. It's management attention. And so for a number of years, we allowed things to kind of languish, kind of status quo. And like grandma's attic, as you shine the light around, that kind of thing, you'll see that's a little bit dusty. And you clean that up, and then you shine your light over here, and you go, oh my God. And so it really is getting down to the 3 to 5 things that really make the organization run and thrive, and focusing on those things.
Well, I really appreciate it. I don't know if any of you are aware of the great history that I have of banging on this drum for 10 and a half years, because the Board of Health should, and vis-a-vis the county, should anything happen to REMSA, we assume all their liability, all their debt. So that's really scared me, not only because it was a recession time, right, and nobody was really collecting like they would like to from their expenses that they have billed out. We were not collecting any property taxes, so that put us in a very precarious position. And thanks to District Attorney Admiran, she worked hard too at clearing that up for me, like what were our liabilities and how do we push that. And then most importantly, I would completely agree, Mr. Dow has changed the entire relationship that we have with REMSA. I feel like you're truly my partner, and a complete asset for this community.
Agreed.
So, I thank you very much. Did that knock anything loose for you guys? Nope. Good job, and thank you for doing that for us. We appreciate it. Mr. Dean Dow, the man of the hour, you got to do the salute to the flag. You're attributed for everything great at REMSA.
Okay, I'm a Texan, I'm wearing this.
I know. I saw you roll your eyes. We beat you. We beat you bad. It was embarrassing.
I will tell you that there was a lot of people in my building cheering for one school. There was one individual, sole lone individual cheering for another school, and I was threatened with my life if I didn't be quiet.
Yes. Well, you know what? Nobody's a loser, though. The only person that's a loser is somebody that doesn't get out there and try. So,
I like that.
yeah. So, Mr. Dow, what can you tell us about operations for February 2008?
For the record, for the board, my name is Dean Dow. I am President and CEO of REMSA and CareFlight. Madam Chair, and to the board, if you have any questions, I'll be happy to try to answer those. You do have the report.
Any questions? I want to note for the record, there was no public relations report this month. That will be coming next month.
Yes.
There was a timing issue. Yes, Councilman Dare?
I have a question, just looking at your guys's, I look through this and always try to find cool things that stick out, but this one isn't necessarily cool, but what is it possibly in October that we dropped down and had bad surveys? It seemed like all year long, everything went great, and October, all of a sudden, it seemed like they didn't like you as much. I don't know. I'm just looking at it.
I was on vacation.
Is that what it was?
Absolutely. He was in Texas.
You are the key. I just, is there
It's all
something
about
to
me.
attribute to that? Is there some
Not really.
staffing?
I think historically, when we look at the surveys that we get back and we conduct, there is an ebb and flow to it. I think where we see the most reaction, if you will, is sort of from the questions related to the billing department, value of the service, those kind of things. And those tend to, those are tough questions for everybody. Even if I'm running a health system, one of the hospitals, generally those are always the survey questions that tend to track lower, more of the year than any other questions. So I think without going back and looking at October, that would be my initial reaction to that question.
Okay.
Dr. Novak?
I
Mr.
agree.
Vice Chairman?
Thank you. I agree. I noticed down the line, it looks like that whole month, every category compared to your total database was down, and that's highly unusual.
Yeah.
Like maybe a hire, I don't know, maybe it was a new hire, maybe some learning curve. I don't know.
Weather?
Well,
Could
it
be.
may be he was on vacation.
And I was on vacation.
Well,
JW was actually running the.
yeah, of course.
I'll
Mr.
blame
Dow,
it on him.
Mr. Dow, could you let us know later, you don't need to bring it to a board, maybe send an email to the district health officer, is it statistically significant, though, the trend?
We will research it. We can get that back to you
Right.
Monday-ish.
No, it's not, I don't think we're in a hurry, we just want to know if it's
No, we'll do
statistically,
it.
I'm sure it isn't, because otherwise there would have been lights and sirens for you guys. But, you know, it's interesting, I just had another conversation and, about statistical significance and trends, et cetera. And, you know, if 50 people show up out of a county of 500,000 people upset about something, that's not a statistic,
Yeah.
right? So it's insignificant, basically. So
We'll-
if you could just drill down, I would think maybe the weather, too. And nobody likes getting a bill from Remza. We love when you show up, but then when we get the bill, we're like, it wasn't even worth it, right?
You know, it could, we'll look at the call volume, because trying to think through the past months, call volume on ground might have been down a little bit in October.
Which would totally skew the, yeah.
So,
Okay.
Good.
Any other questions?
Thank you.
all right,
Thank you very much. All right. Item number 10 is the review and possible acceptance of the 2017 Community Health Improvement Plan, which we affectionately call CHIP, and Ms. Katrina Peters will be presenting that. Well, do we need to vote on Remza? I'm just going real fast, sorry. Motion by Brown, second by Dr. Novak. Any further discussion? Seeing none, no public comment. All those in favor signify by saying aye.
Aye.
Any opposed? That motion carries unanimously. Thank you very much, Mr. Vice Chairman. Ms. Peters?
Good afternoon. I am not wearing a UNR logo, but I am wearing blue, and
Yes.
I'm a UNR alum, so I do want to
Good
start
job.
out with that positive note. I'm Katrina Peters, Director of Programs and Projects, and I'm here to present to you some highlights from our 2017 Community Health Improvement Plan Annual Report. To start really looking at that higher level, there's three main steps in our community health improvement planning process. The first is doing a needs assessment. Heather Kerwin has presented to you our most recent community health needs assessment. So that's looking at both that primary and secondary data, what the data says about the needs of our community. After that data has been analyzed, then there's a need to determine some priorities and engage the community in how we're going to do the work to address those priorities. And we typically write up that plan into something we call the CHIP, or the Community Health Improvement Plan, and I'll be calling it the CHIP today. So those are the three basic steps. And in 2016, January, we published our first Community Health Improvement Plan, so that was the 2016-2018 CHIP. And today I'm going to talk about the progress looking at calendar year 2017. So that was the second year of that inaugural CHIP. And the full document has all the details on our progress in meeting those objectives. And we also highlight some achievements and also some learning lessons, and I'm going to briefly highlight some of those. So for those of you who aren't familiar with the details of the CHIP, it was broken up into four main priority areas. The first was access to healthcare and social services. The second was behavioral health, and that's a substance use and mental health combination. The third was education, and we largely looked at the K-12 environment. And the fourth was food security. And underneath each of those priority areas, there's some very specific goals, objectives, and then some strategies on how to accomplish those. Looking at our first section, which is access to healthcare and social services, 7 out of 10 of those objectives either met or exceeded targets. And to talk about some of those highlights, we put on 3 family health festivals that we got a lot of positive feedback on. We also put on that remote area medical event the last weekend in September that really had a great turnout, provided a big asset to the community. Our 2 federally qualified health centers really provide an amazing amount of services to the community. And you'll see some details on what kind of services they offer and how many patients they see. But we really wanted to highlight the work. That's Community Health Alliance and Hopes of Northern Nevada. We also wanted to highlight REMSA's Nurse Health Line. In 2017, they had over 28,000 calls to the Nurse Health Line, which is, again, a huge asset to our community. Also looking at graduate medical education programs, statewide they were approved for $10 million more in funding, and that came from state funding. And this one's a little bit different in giving a statewide number. Looking at that graduate medical education and residencies, they put that funding towards sort of a variety of different programs in the north and the south, and there was also some that were in Elko. So kind of looking at that statewide picture. And the graduate medical education programs are pretty exciting because when folks do their residency here, they tend to stay here. So the idea there is that that'll help kind of retain that talent here in our state. Looking at behavioral health, there were 19 out of 32 objectives that they were either met or progress was made. 10 of those didn't have data to compare against, and I wanted to kind of call that out because 19 out of 22 we were able to measure. There was some progress made on. And to highlight some best practices, Community Health Alliance has implemented a behavioral health screening during primary care visits, and this is really a huge best practice to try to loop those two together, so really some kudos to them. This is also the second year that a statewide system was used to report bullying incidences. So when we're thinking about sort of that mental health component in schools, we saw an increase in the number of bullying incidences that were reported. That may be a reflection of a greater awareness that that online reporting system is there. So I want to kind of put a caveat on that. In Washoe County School District, 80% of their schools have adopted and implemented a social and emotional curriculum, which is pretty exciting. That's another best practice for curriculum. Also in our behavioral health, the Youth Risk Behavior Survey is a survey that's done every other year in schools statewide. They do some additional questions in Washoe County and oversample it, which is great. Hot off the presses, and there will be some reports published in the next month, but we did see pretty substantial improvements in youth drinking and drug use, and they asked kind of across the full spectrum of marijuana, illegal use of prescription drugs, heroin. We saw improvements in all those with the exception of inhalants. So that's great news. We do also see an increased awareness in the prevalence of behavioral health challenges, but we do still have some substantial issues in being able to meet those needs once we recognize they're there. So still a lot of need for providers, inpatient beds, and funding for treatment. Looking at education, 11 out of the objectives that were written were met or there was progress made. There was an increase in the graduation rate at Washoe County schools. We also really wanted to highlight communities in schools. They work with kids who have been identified as struggling with homeless, and looking at the kids that they work with, they had a 23% higher graduation rate compared to the school district's rate for homeless kids identified. They provide some really great wraparound services to kids that are struggling, and we really want to recognize them for that work. There was also a really substantial increase in the number of adult diplomas that were given out. The only entity that can give out an adult diploma is Washoe County's Rise Academy, and they gave out 331 diplomas last year. So that's an exciting development. Finally, looking at food security, this was a little bit smaller component of the plan, but 5 out of 6 objectives were met. And there was a group that came together called Collaborating for Communities, and their leadership team developed an action plan to address food insecurity. There was also a program implemented called Prescription Pantry, and that's a really collaborative effort between healthcare providers like Renown, Urban Roots, Food Bank of Northern Nevada, coming together so that during a primary care visit, folks are screened for food insecurity and then a prescription's written for food. Urban Roots is also providing produce to really try to increase that healthy food component in that food prescription. And thankfully, we do see food insecurity rates in our community continue to drop. We aren't quite where we were pre-recession, but we're still seeing improvements there. To talk about our challenges, a lot of those were really around the data. So there were some objectives that we just weren't able to match up a good data source to see if we were making progress, and there's definitely a learning lesson there. Also, some of the frequency of data didn't match up well with an annual reporting. When we think about that youth risk behavior survey only being every other year, great source, great way to measure progress, but we aren't able to annually report on progress with that. And also, many objectives make for a big undertaking. So there were over 60 objectives in the first plan, which was a challenge to collect data and monitor progress on. So finally, looking towards the future, we're embarking on a new cycle. So Heather has shared with you some information from our most recent community health needs assessment that we just published in January. And it's going to guide the development of the upcoming CHIP, and that'll be developed through Truckee Meadows Healthy Communities. We've also really tried to emphasize what a great data source it is for the community. It's 300 pages, really comprehensive data source, so we're trying to encourage folks, look there first when they're collecting data for grants or proposals. And with that, I'll take any questions.
Let's start this at this end.
No,
Okay.
Lots of work. Good job.
Thank you.
She does great work. Yep. Anybody else?
Impressive.
I think it's great that we're the repository for data and active data, true data, and that the Washoe County Health District is starting to take, under the leadership of your district health officer, a bigger role of the overall community health and how we can improve that. That's a very new step for us in the last, Mr. District Health Officer, 5 years, 3 years?
3 years or so.
3 years
yeah.
or so, yeah. And I commend that. I do want to mention, too, the food insecurity question came to us because the Federal Reserve Bank came from San Francisco a few years ago when we were putting all of this together and suggested that that was a very important question. And I believe that we are doing that now here at the Health District as well when people come in for clinical care, et cetera, to say, do you have food? And if they don't, we can give them vouchers, et cetera. And that best practice came from East Palo Alto, believe it or not. East Palo Alto is one of the most impoverished areas, living next to the most expensive areas, and very food insecure, and have shelter issues and the things that we do. So I'm glad that we took that best practice that the Federal Reserve Bank told us that we should be doing, and it's been infiltrated throughout the community because that is such a great question and something that some people are embarrassed unless you ask them. All right, do we need, yes, we do. We need to take a.
Madam Chair?
Yes, sir.
Question, yeah. Thank you. The priorities that you guys are now working with Renown and Truckee Mills Healthy Communities, can you restate what those priorities are?
Sure. So far they've identified behavioral health again, so that mental health and substance use as one priority area, housing as a second, and a third of nutrition and physical activity combined.
And the Community Health Alliance is really tackling the nutrition through the, Councilman Delgado, you gave me a tour. What, the doctor at your place, what's it called? The 4 or whatever, the 2?
5210. Yeah,
5210,
yeah.
like 90210, but 52, no more than 5 hours of screen time,
Yeah.
correct?
Right.
2 servings,
No, it's five servings of fruits and vegetables a day.
5 servings of fruits and vegetables a day,
2 hours of no more than,
no more than 2 hours of screen time.
now you're stumping me. See that?
And one,
You got me all nervous.
no,
with
it's
your stuff.
okay, and 0 sugary drinks.
0 sugary drinks.
That's the
but-
number one.
but the other-
1 hour, I think, is physical activity.
Physical
1 hour
activity,
of
1 hour
physical-
of physical activity a day.
Do some push-ups. Yeah, and great information. But what I wanted to ask as well, Chairwoman Jung, is do we know the amounts that have been dedicated from Renown to, as part of their community benefit, to help support some of the community health needs assessments as those priorities that you just stated?
I'll deflect to Kevin on that.
Oh, okay.
No, I don't have a figure for what Renown is going to contribute toward those efforts.
Okay.
Yeah.
I'll just
Perhaps
ask.
we can get that back.
I know the last few years they had come out and said that they'd give $1 million. The previous few years, I don't know if that's changed moving forward as part of their overall community benefit in terms of how they're tackling priorities as part of their community needs assessment. But I'll look through the report. Maybe we can meet with Kevin one-on-one. I know I'll dive into it a little bit more than others, but appreciate your work. Thank you so much.
Thank you.
Impressive.
Yep. So we have not taken action. I would entertain a motion.
I move to accept the Community Health Improvement Plan Annual Report.
A second.
I have a motion by Dr. Hess, a second by Delgado. Any further discussion?
I think my only
Councilman
question
Dare?
is, how do we end up getting a report if we wanted? Is that something we just ask for, if we wanted a copy of the CHA? I know it's long, I don't necessarily know that I need it printed up, but if we wanted to get a copy of that.
we did send a PDF file.
Into the
we-
PDF?
So we didn't include it in the packet because it was
So big.
a pretty good size.
Okay, I did get it
Oh,
then.
but
I
if-
know what it is
But if
then.
you want a hard copy, we could.
No,
render
I
one
did
made
get
for
it.
you.
Thank you.
Okay.
I'm already on it.
Great. Any further questions or discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Item 11 is the review, discussion, and direction to staff regarding the provisions of the interlocal agreement, ILA, entered into by the cities of Reno and Sparks and Washoe County for the creation of the health district. Take action to accept the ILA in its current form or direct staff to forward any recommendations for possible amendments to Reno, Sparks, and Washoe County. Ms. Admiran, this is the legalese.
Right. Thank you, Madam Chair, members of the board. Section 7C of the interlocal agreement requires you to review the terms of the agreement annually. This item was continued from last month. I don't believe a copy of the interlocal agreement as it currently exists was in your packet this month, but it was in last month. Nothing has changed in the terms since 1993. So I wanted to make sure that the board members had time to review the agreement. If so, I have nothing to add to my report.
Great. Any questions or comments or concerns? If
Make a
not,
motion.
okay. We got a motion by Brown,
Second.
second by Dr. Novak. Public comment? All right. Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. That takes us to item number 12. This is staff reports and program updates. We start with air quality management. That's Ms. Albee.
Good afternoon, Madam Chair, members of the board. I really just wanted to highlight an email that I received this morning as an executive officer of the National NACA, our Clean Air Agency national group. The federal budget omnibus bill was released yesterday afternoon, and our legal staff at our executive director's office sat and went through the bill last night and pulled out all of the items that would have air quality impacts. And we were very happy to find out that they are proposing level funding to FY17 enacted funding for all of our state and local air quality programs. There were actually a couple that did have some increases, the Diesel Emission Reduction Act and the state multipurpose grants. So that was really kind of a surprise to us. We were really hoping that, if you remember, the federal budget originally had called for a 30% cut. So we were very happy to see that. And the one thing that I really was surprised about, there was a rider on the bill to postpone the 2015 ozone, National Ambient Air Quality Standard. For a few years, there was a lot of political ball playing with industry and the environmental groups. That rider was actually pulled off. So there is no impact to the ambient air quality standard. So our designation should be finalized next month with a publication in the Federal Register. And I just would sent an email back to let them know how much we appreciated them going through the almost 2,300 pages of that last night to pull that information out for us today. So hopefully the vote is going to be by the close of business or midnight Friday. So I'm available if anybody else
Any
has any other
questions down
questions.
this way first? No. All right. Thank you, Ms. Albee.
All right.
Item 12B is Community and Clinical Health Services. Mr. Cutts.
Good afternoon, Madam Chair, members of the Board of Health. Steve Cutts for the record, and we are going to show you our Washoe County Chronic Disease Report Card. Stephanie Chen, one of our newest health educators to the Chronic Disease Program, who led this project, will be showing you a brief PowerPoint presentation. Happy to answer any questions you may have on the rest of the report that we could do after Ms. Chen's presentation, if that works for you.
Certainly.
All right.
Is that okay, Board?
Sure. Okay, thank you.
All right, Ms.
Stephanie.
Chen.
Good afternoon. Again, my name is Stephanie Chen, and I'm a health educator for the Chronic Disease Prevention Program. Today, I will be sharing a few highlights from our most recent Chronic Disease Report Card. And I hope you all received your copy. You should have a hard copy, and it was also sent. Perfect. All right. So I'd like to begin by sharing this chart, which highlights the leading causes of death among Washoe County and Nevada residents in 2016. Out of the top 15 causes of death, about half are attributed to chronic disease. Chronic diseases are linked to modifiable risk factors of poor nutrition, physical inactivity, and tobacco use and exposure. Our program works on multiple goals and activities focusing on these risk factors to help reduce the burden of chronic disease in our community. This next chart includes obesity rates among adults from 2013 to 2016. Washoe County rates have remained similar. However, in 2016, the rate for both male and female obesity increased to 26%. An approach we are taking to help our community be conscious of food consumption is through our wellness program, We Order Well, or WOW, which works with local restaurants to offer smaller portioned items on their menu. Next, I want to highlight obesity rates among the youth in Title I and non-Title I schools. Title I schools are those that receive federal funds because they serve high numbers of economically disadvantaged children. Title I schools have a significantly lower proportion of healthy weight students and a significantly higher proportion of obese students compared to non-Title I schools. To help address this issue, we have implemented the Wolfpack Coaches Challenge, which helps promote nutrition and physical activity and can be implemented at the elementary school level. We'll now look at tobacco use and exposure. The prevalence of current smokers have remained similar. However, these numbers can improve to reach the Healthy People 2020 target of 12%. To address secondhand smoke in our community, we are continuing to work on efforts such as smoke-free multi-unit housing and smoke-free events. Equally important, this chart highlights smoking prevalence by product used among youth. The e-cigarette rate is much higher than the cigarette smoking, which can be due to varying factors among the two products, in that e-cigarettes are inexpensive, highly available, and come in youth-appealing flavors. There is also the perception that e-cigarettes are less harmful than cigarette smoking. Our program continues to educate our youth and community about the facts and dangers of these products. This next chart provides an overview of tobacco use and tobacco control policy in Nevada over the last 20 years. Our report card includes a description of events summarizing the efforts of tobacco control for Nevada. The last section of our report card includes information related to policy, system, and environmental change. Our program works on a variety of efforts to increase smoke-free environments in Washoe County where people live, work, and play. Having more smoke-free places means less people are exposed to secondhand smoke. Furthermore, smoke-free places also encourage and support those that are trying to quit tobacco. To date, we have 56 smoke-free multi-unit properties totaling 3,625 units. Moreover, we encourage event organizers to hold smoke-free outdoor events and provide signage for those events. One successful example I'd like to share is our partnership with the LGBTQ community, who agreed to hold a smoke-free Pride last year for the first time ever, so that was huge for us. And we recognize businesses for providing a smoke-free environment through our Extra Mile Award. Another effort we are involved in is with Tobacco 21. Tobacco 21 aims to increase the age to purchase tobacco from 18 to 21. Our program is working with statewide partners on steps to reach Tobacco 21, and two major steps include the tobacco retail licensure and merchant training. Finally, I want to highlight our park survey in 89502. And what we did for that survey, my colleague did an assessment of parks, and we were trying to understand various variables that can attract or deter park utilization. And from her survey, we were able to get some grant funds, and now we hope on sharing that information with community stakeholders to increase park utilization. That concludes my presentation, and I hope you find this report useful to continue to improve the health in our community. Open to any questions. Thank you.
That's really great. Questions down here? Councilman Delgado?
Thank you for the report. Great job. Quick question on the youth overweight and obesity.
Yes.
It said that there's a program, the Wolfpack program. Is that something that we're funding, or is that something that's being funded by the university, or how's that being implemented?
One of our grants is funding that, but we are working with the school district and also the University of Nevada Athletics to help run that program.
Okay. How long is the grant for, and what schools did we decide to go into?
So that our main focus are Title I schools. However, the program is open to all schools. We actually just wrapped up the 4-week program yesterday. And so in total for this, last year was our pilot program. This is our second year of implementation. We had 67 classrooms participate, and from all of the 22 schools in total, and only one of those schools was a non-Title I. So majority of the schools we worked with were Title I.
Great, thank you.
Thank
Appreciate
you.
that.
Dr. Novak, Vice Chairman.
Thank you. Quick question, on your statistics that you put up there for basically e-cigarettes, why are we so much even over the national average? Do you have any idea?
I don't currently have an answer to that. I mean, it could be due to varying factors. Maybe one, I especially always think casinos, and so the acceptance of smoking within casinos, and it just could be, you know, our population. I don't have a specific answer, but I think there could be a ton of contributing
I
factors.
just find it very interesting because that's the e-cigarettes that is much higher.
Correct, yeah. It's 30%. And
And that's in your youth smoking group, which is probably not your casino group.
yeah.
Let me ask you this. Where do you get this information? Is this self-reported?
This information's actually, I worked with our epidemiologist, and it's from the BRFSS, YRBSS data. So that's where we.
So the youth self-report?
Correct.
Well,
So it is self-reported.
this is one thing I would say, and you know, Washoe County, state of Nevada, we are, I feel like, as a frontier state, and still a little bit of the Wild West, and lean pretty libertarian. This has been my, again, I've only been here 19 and a half years, so what do I know? What I think is that youth and adults are much more honest in this state when they take their surveys, behavior risk surveys, et cetera, because I think we are much more open, so to speak. And I'm not going to use the politically correct or incorrect. I just think that there is almost like a proudness, a pride that, yeah, that's what I do, and here's the information. Because when I look at the youth behavioral risk assessment data from high school students, I can tell you, coming from California, there is no way I would have filled that out, honestly, because I thought it would go right to my parents, because I'm a minor. And here in Nevada, I think the kids know better, for whatever reason, or they're just evolving better. I have no idea, but that has always been my conjecture. It's just a different culture here, which I appreciate, honestly. And so sometimes I think it's inflated. I remember a few years ago when I don't think any of you, except Dr. Hess, were on the board, had come out that the adults reported the most drinking in all states. And it's like, no, I just think people don't hide it, you know, and you can't address what you don't admit. So I think there's almost a silver lining to the honesty in the reporting and an ability to capture them and then change their behavior. Because if youth or adults won't admit that they're doing something, how could we ever address the problem? So that's, Dr. Hess, do you have any conjecture on that or speculate? I know you're a scientist, you don't want to speculate.
No, actually, I had not thought about it in those terms, and I think you're onto something. I do think there is a different attitude to.
Yeah, live and let live, and
Yeah.
Well, thank you very much. You do a great job. Yes.
Madam, I have one question.
Councilman Dare.
On the heart failure one, I'm looking at this, why is it so much healthier to live up here? I mean, we consistently over the years, it's kind of interesting. You see a jump, I mean, like in 2015, it was 5. Living in Washoe County, you could like do a whole commercial that living in Washoe County will extend your life according to this thing right here. You didn't show it up there, but it's on my thing here. It's just kind of an interesting poll.
Inverse correlation, yeah, it shouldn't be like that.
It's an interesting correlation. Because for state of Nevada, I mean, I'm from Las Vegas before here. Don't shoot me. I'm wearing UNR. I'm good. But but growing up down there, you know, community-wise and things like that, I don't see why this is such a disparaging thing. That's pretty interesting. Yeah.
Anybody else? Great report, and glad to have you on board. I think you probably do a really good job as a health educator, as well as you did at educating us about this.
Thank you.
Thank you. Mr. Cutts, do you have anything to add?
No, ma'am, I do not, but would be happy to answer any questions you may have.
Any questions on clinical and community health services report for this month?
Got a question.
Yes, Councilman Delgado.
Maybe this is more of a public, maybe later on, are you going to come back and do a report on the overall department, or is this a good time to ask questions now?
On the what?
Are you going to come, do we have somewhere here where you're going to come back and speak to the department in general, or is this a good time to ask questions?
This is a good time.
Okay. My understanding is the state is going out for a family planning grant, and they're changing things up. Do you know anything about the family planning and how they're going to go about funding that? My understanding is it's going statewide and does it maybe have potential impacts to the health district? Have you heard of anything about that yet, Mr. Cutts?
Are you asking about the state of Nevada, or are you talking
State of
about
Nevada.
my
Title 10, the Title 10.
Title 10, so federal?
Right.
Yes, so the Title 10 application process is open, and it is open to anyone across the U.S. We are reapplying for that. The application is open now until May 24th, I believe. And I do not know who else is applying in Northern Nevada or throughout the state.
Gotcha. My understanding is that the application process is a little bit different from the past.
The application process is different this year, that is
So
true.
there may be implications to us in terms of others now. It's going to be more competitive, and so it's not necessarily a given that we may receive those grants, right?
Well, I think it has been an open, competitive process in the past. There are some changes in what the application is asking. Different emphasis on contraceptive methods, and we will write the best application. And we
My understanding is that there's just more of a tight alignment with primary care physicians, and that's not something we necessarily have our forte in aligning family planning with primary care physicians. So I don't know if that's going to be
that is one of the areas of emphasis. There are
Among
many areas.
other beautiful ones, like abstinence only, because there's so much data to support that, and just say no, because we all did that.
Yes. So we have already talked with our district health officer, Mr. Dick, and we are planning to write an
The best
excellent
application we can.
Of course.
Absolutely.
And I expect more. I just wanted to be not careful. Of course, we'll do the best we can. I just was wondering about the implications it would have to us in our budget and other things, and if we're
Sure.
thinking about those.
Like any grant application process, we, again, write the best application, and we fill the positions with money that is granted to us and run the program as such. So I think what you're getting at is if there are changes to our funding level or a decrease, which we have experienced in other programs over time, we adjust accordingly.
Okay. Thank you.
It's good to keep your eyes and ears open about it, though, because we went through this is way before, I don't think any of you here, even the district health officer, when Planned Parenthood want to take all of our Title 10 funds. Title 9 is women athletes. And we kind of got into a little bit of a, because I worked for a board then that really didn't want to do any family planning, and, even though we don't perform terminations or anything like that, and was trying to get us out of the business. But then Planned Parenthood came in and go, no, we don't really want that whole grant because they didn't have the infrastructure. So that's been in flux. It's a cycle, it seems like, that we go through based on partisan politics, unfortunately. And it was partisan at that time at this board. So that was an interesting board to serve on, to say the least. So any other questions? But we will write the best grant application that we can. And really what we provide here is not something that I don't think anybody could be morally opposed to. It's prevention and help.
Right.
If there is an unwanted, we don't do terminations. We don't deal in that milieu. Thank God.
Yes.
And that has allowed us, I believe, to be such shining stars, no matter who the administration is.
Right, and we've had a very successful family planning program for many decades now. Our last full audit that we had, which was, I want to say it was about 2 years ago, we had an excellent audit, virtually no findings, a couple of very minor things. So we're very proud of the work that we do, and our clinicians and program management, I believe, are top-notch. So we look forward to this application process.
Great. Let us know however we can support you as a board.
Thank you, we will. Any other questions for me?
Nope. Thank you, Mr. Cutts.
Thank you.
Item 12C, Environmental Health Services, Mr. Chad Westham, Director.
Good afternoon, Chad Weston for the record. We provided the report. We have been working to make it better each month. I don't have anything in particular to highlight. It's business as usual, and our required work is getting done, and we're helping the community with development and plan reviews. If you have any questions, I'm available.
I do.
Councilman Dare?
I have two questions. One is I just always want to keep up with our growth and making sure that that you have the staff that you need to continue to make sure you stay on that. And I think it's just a continued check. I don't even say that because I didn't get any local phone call recently. I had nothing. We're growing. And
Yes.
and I do know at the same time, and this has to do with the other thing I wanted to say is at Tumwa, it looks like all that they have is moving forward, which hopefully relieves some of the need of us hiring anybody anyway. So hopefully their permitting process is easier for them. But it is a question that I'm constantly looking at the growth, because we haven't hired anybody in this position, but knowing we're growing.
Right, Councilman Dare. So Tumwa, they had a waiver that was reinstated where they can review water projects that are less than 500 feet in length. So that was a relief of work for the division. The development of the community is very high right now, so we have turnaround times that I'm not fully comfortable with, so we're working to bring those down. We've diverted staff from other programs temporarily to review plans. We have the city of Reno is now delivering plans over to our office versus our staff having to courier the plans back and forth.
Absolutely.
Thank you. And so it's like a daily meeting and brainstorming on what we can do to streamline things further. But we're in good shape with our current staff.
Thank you. That's what I
Yeah.
was asking. Appreciate it. Thanks for your hard work on that. I know with ever growing and just because someone complains or has their thing, it doesn't mean they did it right, and it doesn't mean it's on you guys. But we want to make sure we are doing our best to make sure we have the right tools in place. So thank
Right.
you.
Thank you.
Dr. Novak?
Yeah.
Vice Chairman?
Thank you. Still.
Soon to be chair.
Yeah. On the report, you got 3 or 4 graphs in here, or charts, and they're great. Could you add one more column to the end of the year for last year?
Yes, Dr. Novak, what would you like?
No, on all of these, you have year-to-date, a summary here. Can you give us the year-to-date column from like last year, so we have some idea where the comparison is?
Oh, for the last calendar year?
Correct.
Yes.
On all of these, and hopefully it'll be a fairly easy job to pull these up.
Yeah.
Since they look familiar.
Absolutely. We can do that.
Thank you.
Great idea, Dr. Novak, Mr. Vice Chairman. Any other questions? Thank you very much, Mr. Warren. Item 12D is epidemiology and public health preparedness. Dr. Todd.
Good afternoon, Randall Todd for the record. I just, because of when we turn in these reports, sometimes there can be a bit of a lag, so some of the data for certain topics can get a little bit stale. So that's particularly true on the influenza reports. So I just wanted to say that for the week that ended March 17, which is CDC week 11, I think in your board report it's week 9, so this is 2 weeks more recent. So for CDC week 11, the 12 sentinel providers reported a total of 154 patients with influenza-like illness. The percentage of persons seen with influenza-like illness was 2.1%, which is below the regional baseline of 2.4%. And during the previous week, which is week 10, so it takes us a little bit longer to get the national data, but the percentage of visits to U.S. sentinel providers due to influenza-like illness was 3.3%. That's above the national baseline of 2.2%. And on a regional level, the percentage of outpatient visits for influenza-like illness ranged from 1.9 to 4.9. We had 8 death certificates received for week 11 that listed pneumonia or influenza as a factor that contributed to the death. And the number of deaths submitted for week 11 was 103. That reflects a pneumonia and influenza ratio of 7.8%. The total pneumonia and influenza deaths registered to date in Washoe County for 2017-18 season is 208, which reflects an overall P&I ratio of 8.8%. A lot of numbers that I threw at you, but here is Some others, more numbers that I think will be somewhat easier to understand. So total laboratory confirmed cases reported this year, year to date, this flu season, 5,167. Now, to put that in some perspective, last year, for the entire year, it was 2,417. So it's more than doubled. And the year before that, it was 1,532. So it's been going up. Hospitalizations this year for lab-confirmed influenza cases, year-to-date, 498. Last year, for the entire year, 315. And here's a real shocking one. The year before that, it was 53.
Wow.
Just a couple more. ICU admits. This year, year-to-date, 80. Last year, 57. The year before that, 10. And deaths so far this year, 23. Last year, 8. And the year before that, 3. So this has been a banner influenza year, and I just wanted to give you some more current numbers and would be happy to entertain any questions you might have.
That's very sad data. Those are
It
human
is.
beings. Yeah.
Question?
Yes, Dr.
Yeah.
Hess.
Do, the influenza vaccine this year has not been all that great. Have you been able to see a direct relationship of people, how many of the percentage that actually were vaccinated and still died or were hospitalized and what have you?
We, for this year, I'd have to go back and look to see if we had it for last year, of the hospitalized cases, how many were vaccinated. There were some, and I think that percentage is fairly high this year because the dominant strain for much of this flu season was the H3N2, which they don't have a very good vaccine against H3N2, unfortunately. It doesn't work very well. They are trying to improve it, but when that is the dominant strain, then you expect to have a fairly bad flu season.
Thank you.
Great question.
I got two.
Yeah, Dr. Novak, my vice chairman.
Two questions. On all your statistics over the last couple of years, has the vaccination rate gone down? Or was, because did we have a higher one before when there were fewer cases? Or is it just the effectiveness of the vaccine? Do you have any handle on that?
I don't have any data right at my fingertips here. What I can tell you is that Nevada has the lowest immunization rate for influenza in the nation. I think I might have reported on this last month, but I looked at like 5 years worth of data, and in only one of those years were we not the lowest. And that particular year, we were second to the lowest. So I'm not sure why it is that Nevadans don't want to get their flu shots, but
Kind of maybe the reason why they're not ashamed to say that they imbibe.
perhaps. We certainly hear a lot of talk about, well, I don't want to get a flu shot because I might get the flu from it, which is impossible. I've heard people say the only time I ever get the flu is during the year that I get a flu shot. And it's important for people to realize that it takes a couple of weeks for a flu shot to become fully effective. And so if you got infected during that time frame, you may get the flu in spite of the fact that you had a flu shot. And the other interesting thing that's been going on, Dr. Novak will be aware of this because I talked about it last month at the Rotary Club, but that's canine influenza is becoming.
I was going to ask you about that.
Is becoming a much more significant problem. There are 2 strains of canine influenza that are going around. The more recent one is also called H3N2. It is not the same H3N2 as the one that humans are getting. And so we're a little bit concerned, though, that they are closely related enough that that situation could change in an upcoming flu season. And interestingly, I mentioned that it takes a couple of weeks before the flu shot becomes fully effective. They're saying for a canine flu shot to become fully effective for your dog is 3 weeks.
Yeah.
So
Where are we with the canine flu? Do you have the data in front of you on that or no?
I
Yeah,
don't.
We
'cause
haven't
that's
heard
not-
much.
That's
yeah.
not reportable to us.
I know.
But I know my sister-in-law has been visiting us from California, and she brought her golden doodle with her, and we made sure that she took the golden doodle down. I think she'd had the first in the series of shots before she came up, and then she got the second one, and then we made her wait 3 weeks before she took the dog to the groomer.
Sure.
So that she would be safe, because that's one of the places where dogs can get this is if they go to a kennel or a groomer, where they're
Or the vet.
exposed to others. Yeah. So we did what we could to try to prevent
That's
her
wise.
animal from getting it.
Yeah, that's hard with anything with the doodle in them because they don't shed. My parents too have a Sunshine, our little miniature poodle, or she's not like this, but she's a poodle, and they just took her to the groomer today because she looked horrendous.
Yeah.
Because their hair doesn't shed. But I was concerned about that as well. I had a question for you about that. No, just something to tell the public. If your dog is sick, or you need to see your dog for whatever appointment with your veterinarian, most veterinarians will come out to your car and see your dog if you're afraid of the dog flu. And when the dog flu is over, my dogs will be getting the shots, but I don't want to take them to the vet either.
Understand.
So I mean, just don't not go if your dog needs it, because they will come out to your car if you let them know that you're afraid of the dog flu.
Yeah, and I think that was the situation with my sister-in-law's dog.
Yeah. Mr. Vice Chairman?
I have a second question. Is this a second case of CPO? Carbapenemase?
Oh, well, we've had a number of cases of carbapenemase resistant or carbapenemase producing organisms. No, it's not the second,
Okay. It's just the latest.
just the latest.
Okay.
Yes.
Any other questions? Councilman Delgado?
Hello. Mr. Todd, though we are last across the nation in terms of flu shots, have we been making increases in terms of from what we've seen year to year?
I don't know the answer to that question. It's a little bit of a difficult statistic to get your hands on, just because the population changes, the numbers of people getting the shots changes, and actually getting the flu shot is not a reportable event to local public health, so we rely a lot on national data, which I can't slice and dice quite that finely.
The reason I asked from Immunize Nevada, I know they do a lot of work and they push hard, and I just wasn't sure if through their campaigns and if that's made impacts or not. I mean, I know we're still got a lot of work to do, but.
Right, and the other thing I don't know, you didn't ask me, but the other thing I don't know is how much of that poor performance statistic is due to Southern Nevada versus here in Washington County. I'd like to think
That was gonna be my follow-up on.
that we do better.
Exactly. Thank you, Mr. Todd. Dr. Todd.
I'd like to piggyback on that a little bit, Mr. Councilman. I think that the District Board of Health needs to reach out to their community partners for the next flu season and do a real push for Washoe County to get people immunized for the flu. And let me tell you where all the nexus disease are. So, of course, we care because we are the District Board of Health, but most importantly, we should be getting money from Renown and the other hospitals and clinics here to help with this information campaign, and Washoe County proper, because not another fund transfer, but they should own it, our communications team, because Washoe County, as the regional provider of indigent care, we pay all the hospital bills of the indigent, of course at a much cheaper rate than what the average person pays, but that is a big part of our budget when we're looking at indigent care that could be going to better services like providing shelter for homeless, not shelter, I don't even like the word, houses for house the homeless. And so we, as a county commissioner, I can tell you we have so much skin in that game. We should start collaborating now to get the big push, and then we would actually have a data marker too that we can say that we move the needle and hopefully save lives and ultimately even save tax dollars.
Agree.
Thank you. Uh-oh, here comes Mr. Cutts. I stirred the pot here.
Sure.
Thank you, thank you, Dr. Todd.
Steve Cutts for the record again. So as Councilman Delgado pointed out, we partner with Immunize Nevada. They are a statewide nonprofit now, so both North and Southern Nevada. They do extensive flu campaigns. They've had large grants from the federal government. And we partner with them all the time. We do our school-located vaccination clinics that we report on monthly in our Board of Health report. Perhaps I can chat with Heidi Parker, the executive director, to see if she could come and do an update for you.
Great.
I don't know if you would want something as flu season is wrapping up, or if you would
We need to
prefer
start for
something.
next flu season, today.
You want something?
Yeah.
Okay, I'll talk with her and I'll chat with Mr. Dick
And even if we could just, I mean, clearly I'm not a public relations or marketing person, but even just to drill into people's head, you don't get the flu from the vaccine. It's not a live vaccine. You don't get, what's the other, I saw all over Facebook, my kid will get autism if I vaccinate them with the flu. And then the other thing is just teaching people like their moral responsibility to get the flu shot because of the herd effect of that. I mean, there's so much education that I don't see out there. Again, I don't watch TV, so I don't know and who the communities they're targeting. But I still say, let Washoe County's communications team be the lift, because we should be better than that. And I don't want to look at it as a state. I'm tired of being lumped in as a state. I want county data, specific to who gets immunized, who gets sick, and let's make that statistically significantly different the next flu season so that we can prevent these deaths, which are people's loved ones. And then the other side, when you talk about ICU, that's very expensive for me as a county commissioner for indigent care.
Absolutely.
Councilman Delgado, did you have?
Maybe Mr. Cutts can correct me if I'm wrong, but just really an interesting statistic that I learned was that it wasn't necessarily what we had sometimes assumed, demographically speaking, the lower income communities that weren't getting vaccinations, those educated
elitists.
come and
Yes, and I think that you are correct. I think that Ms. Parker could come and do an update, and perhaps we can do it in April, which is National Infant Immunization Week, the last week of April.
Great.
So maybe she can just come and do an overall update. I know that in the more affluent communities here, not only in Washoe County, but across the U.S., that is where you will have some more resistance and hesitance and reluctance to immunize, which is evidence science-based, and we know that it provides, it's the best thing out there you have for prevention of vaccine-preventable diseases.
Absolutely.
Okay.
Great.
Thanks, sorry.
Thank you. Do you have anything else to add, Dr. Todd?
I just wanted to mention one other thing because, Madam Chair, you brought up about getting the media to cover this. I think this year we've probably had more interviews from the television stations at least, and to some degree the print media as well.
Sure.
But we've had more reporters coming back repeatedly to talk about flu than I can remember in any previous flu
Right.
season.
It still didn't move the needle.
No.
So we need something else. But who watches I'm sorry, I don't watch TV, so that would be hard to get me into that, into that. There's other ways to communicate with people.
Understand.
And listen, I'm not the 2% or the 15% or anything, but Councilman Delgado has a good point to that. And people often say, well, it's people that don't have access to it. It's completely false. It is the academic elitists that say that they have data that this would give their child autism, or it's the government trying to control them. And this is not a fake news. This is verifiable data. And I just think that we don't move that needle enough in the population in which we do. And I would guess those same people don't watch the local news or get the local newspaper. They probably get New York Times or Wall Street Journal. You see what I'm saying? And that kind of skips over them and their peer group.
Okay.
Thank you.
Thank you.
Item 12E, Office of the District Health Officer, Kevin Dick, District Health Officer.
Thank you, Madam Chair. One of the requirements of the interlocal agreement is for the health officer and my staff to meet annually with the city and county managers and report back to the board on those meetings regarding our budget. And so we met on the 1st of this month with Manager Newby and Manager Driscoll. County Manager Slaughter was out of town, and so we met with Assistant County, and I'm seeing a typo in my report right now, Assistant County Manager Solaro, not city, attending for Manager Slaughter. We explained the budget to the group. It was well received. They appreciated the sound financial position of the health district. Manager Driscoll did inquire about the reasons that we were pursuing accreditation. We explained to him how we felt that this was a benefit to the health district, both for improving the quality of our programs, but also having that actual accreditation as a benefit in the future for being able to have access to different grant funds down the road. Manager Newby asked about the number of FTEs that we were adding to our budget, and you'll recall that was 3.39. One of those FTEs is the environmental health specialist position that we've put in the budget contingent on an agreement with the City of Reno to provide $150,000 from their enterprise fund to support that. And Manager Newby did confirm that the City of Reno was working on that agreement to provide that support. So that was promising that we'll see that moving forward. She also asked about, we are requesting an above base request of $192,750 for mosquito abatement. And she asked about how big that was compared to our base budget. And just for your information, it's about $235,000 is the base budget that we have for mosquito abatement. That $192,000 is additional 1,000 acres that we'd be able to larvicide if we get that above base request. Then Manager Driscoll inquired regarding the level of the cost of living increase that was incorporated in the budget and the funds that were budgeted for OPEB. And so it's a 2.5% COLA increase, and we provided that OPEB amount to him. Mr. Cutts explained a little bit more about our billing successes and the reason for the billing specialist for third-party payment. And Ms. Albee also talked about the Ozone Advanced program and how that was successful in being able to help us retain our attainment of the ozone standard as far as our designation. Moving on to public health accreditation. I just wanted to also highlight to the board the work that's continuing to go on to compile the documentation that we need for that accreditation. Ms. Peters and Ms. Hilliard traveled back to DC last month for the training from the Public Health Accreditation Board on that accreditation process, and they found that very, very beneficial as far as them being able to come back with a lot of additional information and understanding beyond what they could glean from going through all of the documentation about the accreditation requirements. We were assigned a person to coordinate with FAB, who's actually located in Las Vegas, so within our time zone. And we're provided an opportunity to provide some of our documents that we're pulling together for our accreditation, a limited number for them to review and provide us with feedback on as far as is it set up the way they're looking for, that type of thing. So we're putting those in to take advantage of that opportunity and continuing to proceed with our accreditation effort. I wanted to mention on the water projects that we are continuing to coordinate with TUMWA, and we had a meeting with AGC, the Associated General Contractors, just on Tuesday of this week to provide them with an update on water project progress. As Mr. Westham mentioned, we have that waiver that was established, reinstituted at the beginning of December. And then Friday of last week, the Nevada Division of Environmental Protection submitted proposed revisions to the NAC regulations that we have had a work group working that they've established working with Clark County, some rural counties, and ourselves and TUMWA on what that would look like. And so we're hopeful that will continue to move forward for adoption by the State Environmental Commission. And some of the revisions in there would eliminate a few of the key issues that we've had with separations but still in a manner that's protective of public health.
And water quality.
And water quality.
Hello,
public
Flint.
health.
Yep.
So it was interesting that at our meeting at Tumwa the other day, one of the complaints that we did hear was in regard to phasing of water projects. And that's not actually something that the health district has any role in. It's something that Tumwa has done, and I think they've got some good reasons for doing it. So the biggest complaint was not related to us, and Tumwa's going to come back and talk to AGC at the next meeting about why they're doing that. And so that's my update on. Let me add one more thing. We mentioned the waiver. NDP is still working on an interlocal agreement that would be established between the state division, the health district, and Tumwa that would provide for less review of each water project on the part of the health district, and another mechanism for oversight of Tumwa by the health district. And that effort was delayed a little bit because of the crunch in trying to get the NAC revisions submitted to LCB, but now it's come up in the pile for NDP to be working on that interlocal agreement.
Good.
So, and then lastly, I just wanted to also provide an update on the county health rankings. Those came out on March 14th, and I think people have seen that Washoe County, we did drop from 4th to 9th. These are rankings of the counties within the state. 4th to 9th for health outcomes. And that is basically a measure that looks at premature death rates, and it looks at quality of life as self-reported in some of those surveys. And the key reason that we dropped from 4th to 9th is because of the self-reporting of poor physical health days and poor mental health days that people had experienced in the previous 30 days. The data in the county health rankings is lagging, so this was data from 2016. But I think it's important to note that that self-reporting went from 4 poor mental health days in the month to 4.6. So it was kind of a significant increase. And we don't know exactly why that's the case, but we do know we do have stress in our community that's caused by some of our housing issues for a good portion of our population. That was also an election year. I don't know if that weighs differently on people here in Washoe County than the rest of the state, but that was another factor certainly going on that year. So I'll conclude my remarks there, I guess. And,
Thank you. Thank you for that.
Go Pack.
Go Pack. Any questions down here for the district health officer? Councilman Delgado?
No, I'll reserve for the board comment 13.
Okay.
Thank you.
Great. Let me just check here. Councilman Dare?
I have a question just regarding the opioid portion. You didn't mention it. I know it's on here and I was reading through it. But back in DC, there's a lot of conversation about finances that could potentially help with some of the crisis that's happening. I was just back the last week in some different meetings. And I just how are we opening, making sure we're paying attention to those and the grant setting, making sure that if there's finances to come our way to help. I know I visited one of our wellness centers here that help give out the elixir that's given every day to these, and they struggle with worried about not having what they need. And so just trying to help make sure that we, I don't know, I'm sure you are, but just making sure that this stays on the forefront. And I'd like some information on just what is it that we have and what are we able to do, and if there is any true help that's coming from our federal.
From DC. I can speak to that. I was appointed, as was the district health officer, as was our medical examiner, to the Attorney General's opioid working group. But we were appointed by the governor and convened last 2 weeks ago, 3 weeks ago. Everything feels like a month ago to me. 2 weeks ago, maybe, March 8th. And getting our arms around just that, funding and treatment and the lack thereof, lack of beds, in the whole state, a lack of service providers. What I think most importantly came out of that, I don't think there's any federal funding coming from that, but good luck. I think you should definitely have an optimism for it, but I think what we've learned so far is we're on our own. But what we've really learned that came, I already knew this, but I wanted to make sure everybody else knew, and you need to know it too as a Board of Health, in that our data in this state is seriously flawed because only 2 counties have medical examiners. All other 15 frontier counties, sheriffs, are the coroners. And maybe they are MDs and that's why they become sheriffs, but I seriously doubt that. And so we leave it up to them to tell us what the cause and manner of death was. And the flip side of why that is first of all, because I think it's very archaic and that's a law that should be changed, is that it costs $3,000 per autopsy that is sent to Clark or to Washoe. And that's a cost-saving measure for them. So what I have proposed is perhaps, and maybe you guys could help me push this, a nexus for our 3% excise tax on marijuana, whether it's recreational, medical, we don't talk about that anymore in the county, it's just marijuana, using that money to subsidize, not wholly, because then those counties will then be sending us everybody, but even our medical examiner says she would rather have more autopsies than less because we can track health. But maybe we pay half of it in those situations when nobody knows the cause and manner of death, because right now they're sending us nobody. So we would never even be able to qualify for a grant at the federal level because we have really bad data. And here's the worst part. The rules are the most abusive of the opioids. And that has a lot of things to do with poverty, lack of opportunity. One of the counties, it's either Mineral or Nye, which one did they say? They have more prescriptions out there, Nye or Mineral County, than there are inhabitants of said county. So no, I don't believe the feds are going to help us until we figure out a way to create some good data. And we can't help ourselves if we don't have the data. And the only way that we ever find out if it was an opioid-related cause of death in general, please don't quote me on this, is if the sheriff walks up or his or her designee and sees the needle in the arm and says, oh, clearly this is an OD. But then we don't even know what the OD is. Is it fentanyl? Is it? So we have a huge break there. And I'm not saying governor and attorney general, please give us more money. I'm saying we have that 3% excise tax that's going to bring a decent amount of money in. I don't want to quote it right now because then all of you will be jumping on where else I could spend it. I just think there's a perfect nexus for that. If you're, gambling, some revenues go to Gamblers Anonymous and treatment centers. Marijuana, with our 3% excise tax, I am comfortable. I think I could get the votes for my county if you help with your commissioners so that these suspicious deaths are sent to us. And ideally, every death that is suspicious and you can't determine should be sent to the medical examiner because, again, it tracks your health and your susceptibility to anything that's possibly out there. So that's the crux. We're meeting again in May, correct? Yes, in May. And looking forward to some good solutions and some real science in how we're going to crack this nut. And the sad thing is the counties that we probably need the most data from, we don't have. I would never be confident to present that data nor stand by that data because it's flawed. Anybody else? Any questions? Alrighty then. Board comments. Let's go to Councilman Delgado. He called it first.
Thank you, Madam Chair. And question to Mr. Dick. I was Googling just now. I want to say it was Senator Kinsella, but those are waiver that was passed, I want to say last legislative session, for those children who are documented, but previously would have had to wait 5 years before they became eligible for Medicaid, and now that was waived, so now they're now eligible. Are we working with the state, or how do we get that information out to our constituents to know that that's now available and they don't no longer have to wait 5 years to get Medicaid coverage? It'd be good to hear what we need to do, or if we're working with the state on the next agenda to get an update anyways on how we're going to push that through. Thank you.
Dr. Hess, do you have anything?
No, I don't.
All right. Anybody down here need further? Yes.
I just have one announcement. If anybody's interested, it's health and ALS. There's an ALS walk on May 5th, and I'll be out there walking. If you need a team to join, you can come join with me. And I'll be out there, it's at 12 o'clock is the walk, and they do a bunch of stuff, but it's, I mean, obviously, it's Lou Gehrig's disease is a debilitating, very, very difficult disease. And so anybody helping or want to come out, and it's at the marina on May 5th, and I'd love to.
And Dr. Novak will make us lunch afterwards.
Sounds-
Because he lives at the marina.
Yes, he does, actually. Thank you, that's all.
That's great and timely because we just lost Dr. Stephen Hawking to a very terrible disease and probably one of the greatest minds that we will ever live in our lifetime with, and probably should have been laid in state, but that's just more political stuff, and we're not going to go there. I do want to just announce that I did take a tour, and I encourage every one of you on this District Board of Health that I'm seriously considering changing my primary care physician to the Community Health Alliance with Councilman Delgado and Mr. Duarte, who also serves on our Behavioral Health Policy Board, in which they get 5 BDRs, thanks to Senator Julia Ratty, who used to be my vice chairwoman. Mr. Duarte, he's the chair, and he has vast experience in Medicaid and believes that there are ways we can use Medicaid for housing, which is a great breakthrough and probably going to be the leader nationally when this happens. And the reason why I say I would like to change my primary care physician there is because if you remember, that also subsidizes if you go to Northern Nevada Hopes or Community Health Alliance, or I also go to Restore Smile, which is a nonprofit, people with insurance are really subsidizing those who cannot pay. And I think that's a great model in a system in which healthcare rates are just out of control. So thank you for that. And please reach out to Mr. Delgado. And Mr. Delgado, I have not forgotten. Please, Mr. District Health Officer, reach out to Mr. Ulibarri and our comm team. I promised them a video on our public service announcements to put on all the governmental channels about what the Community Health Alliance has to offer, including their childhood obesity
5210.
50210. 5210, and be able to get that out bilingually as well. So thank you for that invitation, Mr. Delgado, and that really opened my eyes. And it's a beautiful, beautiful center, and some real social work going on there. How about if I just say that? It's beautiful. It's more, to me, it's biblical. So I had a great time to be there. You know, I think that's our job as human beings. Anything else? Madam Clerk, do we have public comment? Would anybody here like to make public comment that did not fill out a form? Ms. Brandhorst? You can come up here for 3 minutes, and if you wouldn't mind, please fill out a form. I saw you back there, and I don't think the forms are back there, or maybe you weren't sure what to do with it, but we never want to prevent somebody from commenting on the public record. Ms. Brandhorst, you have 3 minutes.
Yes, thank you. My name is Kathy Brandhorst, and I am the United States President. I just wanted to tell you, I'm still on C Street in Sparks. My contract was over, my rental contract was over 3 months ago. And the gentleman is still homeless. He still sleeps outside because I am paying month to month to month. And I have already been overstayed for 3 months now, and I paid those 3 months, but this month was kind of late on my rental contract. I'm not my rental contract, it's over. It would be my month to month. And this gentleman still needs help, you know, because he's supposed to live there and I'm supposed to be moved out. I moved to Sky Mountain, and unfortunately, there are people who are living inside my house, my home, and I cannot seem to find nobody to help me get the people out of my house. And so the problem is still existing today, and it's not only a big issue. I mean, this gentleman has suffered so much. I found him underneath my apartment trying to keep warm with my heater. And he sleeps outside. He's been found frozen to death. And he has no place to go because this is his home that I'm living in. And this situation is still going on today. But he doesn't seem to get the help that he needs. I don't even see people, helping him out at all. And this is not fair because he is U.S. born and he has the right to live where he's supposed to be living. He pays his rent. And so do I. Oh. And I was supposed to move out 3 months ago, and this man is still waiting for me to move. So if you have a solution for both of us, we would really appreciate it because now my situation is people in my neighborhood keep telling me, Kathy, you don't live here, get out. And they're right. I need to get out. That's not my home. That's not where I live. I do pay my rent, though.
Thank you very much, Ms. Brandhorst. If you could do me a favor and see our clerk over here to fill out a public comment card.
Oh, I did.
Oh, you did?
Yeah.
Oh, could you fill out another, maybe you forgot to give it to her? We just need it for the public record.
It's back in the back. She left it back.
Oh, she left it in the back. If we could make sure, Madam Clerk, that we get a hold of that, that would be great. Well, is there any other public comment? Anyone? Okay, we are adjourned.